Time now for the Business Spotlight here on the WMAY newsfeed. It's sponsored today by SIU Family Medicine. Dr. Careyana Brenham is here with us to talk about something that's very important, very timely, being offered now through SIU, a Gender Equity and Transgender Clinic. Doctor, first of all, welcome. Thanks for being here with us.
Thank you for having me. I appreciate it.
Let's talk about how this came to be and why is such a clinic now in operation?
Sure. No, I'm happy to talk about that. So I will just give you a little background. I am the family physician and the residency director here at SIU Family Medicine. And so we have 30 residents and we train them on all aspects of family medicine. We have patients of, all genders and patients of all backgrounds. And we often have experienced several patients coming to us that are transgender and have been seeking medical services such as hormone affirming therapy in particular. And really, we originally were making referrals for those, and often patients were having to travel to places like Chicago or Springfield. So we thought, you know what, this is something we really have a need for in our community. And we decided we wanted to offer it here at our clinic. From a personal standpoint, as the family medicine residency director, I also saw a huge need for this from an educational standpoint. So we train, as I mentioned, 30 residents, and those residents are going to be going out and practice in the future when they complete their 3 years of training. And what a better approach to being able to have more opportunities for patients to receive services that are in the LGBTQI population. And feel that it's in a great environment, respectful manner, and somebody that is trained to do potentially something like hormone affirming therapy. So we thought that if we offered that here at our clinic, we would not only be able to improve the benefits of our patients locally, but we'd also be able to potentially, by training residents, expand these services into wherever they may decide to practice in the future.
I'm glad you mentioned that about the training aspect of this. This is such a widely misunderstood area, both from a medical but also from a social standpoint. Has it been in the past difficult for transgender or non-binary individuals to receive the kind of care that they need?
And, absolutely, there have been some struggles. Hormone affirming therapy, so those that may be masculinizing or feminizing hormones are something that some physicians may not have the experience in prescribing or the comfort level in prescribing. And so patients will often see their primary care providers or others and request these services. And they may have a provider that just doesn't have the comfort level or the experience in prescribing those. And so they would make referrals for their patients. And we had heard patients that were traveling to St. Louis, to Chicago, out of our local communities and traveling far to be able to get medical treatment that was something that they were going to have to go receive ongoing and would be an entire part of their life, and having to travel to be able to get that ongoing medical management is very difficult. And we had partnered with the Phoenix Center here in Springfield, and in talking to Jonna Cooley, she really did express that a lot of folks that she ran into there and that they were receiving other services at the Phoenix, that they were having a difficult time finding sometimes local support. Now, there is Planned Parenthood, and so I don't want to suggest that there's no support or no availability within the community. But patients were, wanting to be able to go someplace where they would be able to have their full spectrum care and their primary care. And we thought, what better way to do that within our clinic? And if patients were not finding what they needed at another clinic, or really wanted to maybe transfer care that they were receiving in St. Louis or Chicago to our area, then we would be happy to provide that.
We're talking with Dr. Careyana Brenham about the Gender Equity and Transgender Clinic at SIU Family Medicine. And Doctor, I think there is, again, some notion that this is more of a psychological issue as to how people, feel that they identify. But you're indicating there is certainly a physical medical component to this. You talked about the gender affirming therapy. Can you describe that a little bit more and talk about some of the other services the clinic provides from a medical standpoint?
Sure, absolutely. So, I mean, from the perspective of a patient that comes in that may identify as male, but their assigned sex at birth was female, they may have a discordance in what they look down and see at their body and what they, identify as and who they know in that they are. They know that they're a male, but that they look at their body and they see more female characteristics. They may have if they know that they're a male, but they are still having menses and having other just regular, may have those things that other females go through, but they identify and they know that they're male. And so we look at the medical management of helping their bodies and the way that they feel and their characteristics match who they are, match the sex that they identify as. And so what we will do is do hormone management. So somebody that identifies as male, we would do masculizing hormones, something like testosterone, that would have benefits to them from a medical standpoint, but overall perspective, helping them maybe deepen their voice, make them have a stronger muscle mass, potentially even have facial hair growth, stop menses, although we may do other management to help with that too. Other characteristics that will help their body and their physical outward appearance or their physical, just how their body functions to match the gender that they identify as and the gender that they know that they are and help their body match to who they are. And same way from the other perspective too, those that identify as female, doing some of those feminizing hormones will help them identify and will help them feel and have those characteristics and have the outward appearances of their body, potentially have the way that they feel on a regular basis, maybe things like voice changes, so forth, match the sex that they identify with.
So
And so we do. Oh, sorry, I
please,
think we do have some referral sources. So you asked about, what about other things? We do actually have some wonderful physicians in town and elsewhere that we can refer for surgical opportunities too. So we offer the hormone management here, but we may make referrals for something like top surgery, somebody that identifies as female doing breast augmentation or male having breast reduction or mastectomies. And so we have referral resources like that too.
So how do people access the services of the clinic? Do they need a referral or any kind of an advance evaluation?
So yeah, so we have a lot of different ways. So if somebody is looking for a new primary care provider and they do not have somebody they identify as their regular PCP, so their regular family physician, we are happy to see them in our clinic for their full spectrum care. So we can see them for primary health care, so for their preventive health screening, things like checking their cholesterol, things like doing things for cancer prevention, so forth. And we can also see them in our Gender Equity Clinic. So they can just call and establish with us. They can let us know when they call our office and let us know that they want to be established in this clinic. They can just call and make an appointment. If, however, they have a primary care provider that they are already established with, so they have somebody that is providing all of their other healthcare needs for preventive healthcare, but they just aren't able to do the hormone affirming management for them, then that provider can refer them to our clinic and we can get them set up. We can make sure we get that clearance through insurance to get that referral approved, and then we can see in that matter. So we do either way. We can have those patients have referrals from their regular doctors, or they can just call and get set up here. Phoenix Center also has our information, and they can refer over here too and give you information on how to get set up in our clinic.
Dr. Careyana Brenham, thank you so much for your time. Once again, give people the phone number or how they can access SIU Family Medicine online.
Sure. So, SIU, as far as access phone calls, we always just tell people call our main number, the 217-545-8000. If they call that main number, then they will be, and they just say, we are interested in the Gender Equity Clinic, they'll direct them in that way. And that way there's somebody always available too. We do have two people that are screening those phone calls and making those appointments, but calling that main number is a direct route in. And then as far as looking at the SIU Med website, you can take a look at that website and then you can get some more direction on that way too.
And that's siumed.org. Dr.
Yes.
Careyana Brenham, thank you again so much for joining us here in the Business Spotlight on the newsfeed, WMAY on 92.7, 94.7, and 970 AM.